We know you have a lot of questions, so let's get right to our first guest, formerly of Sacramento, now a practicing Roseville physician, Dr. Thomas Hopkins. Dr. Tom, welcome to Coronavirus Facts Not Fear. I love your office shot there. That's very nice. Do appreciate that.
It's good to be here, Paul.
Okay, good. First question. Do all cases of the coronavirus have to include a fever?
Well, what we know right now, not always. It really, this is to think about the symptoms. There are a progression of symptoms as they start. So some folks will have a fever, some people won't. But one of the things that the cough, the headache, body aches, those things may be in the earlier phase. So not every episode of infection of COVID-19, it requires a fever.
Okay, that's good to know. Okay, next question. Can I have a neighbor visit me in my home? I live by myself. What do you say to the neighbor who wants to pop in?
Well, just, what I would tell them, just social distancing. You have to be polite about it. Just tell them. I think everybody is aware of COVID-19 and the risk. Really, you want to try to keep your home environment safe. So that's what social distancing is about.
Okay. Are there any over-the-counter medications, next question, that you can take for the symptoms? Would you take something that you might normally take for the regular flu?
Well, it's like you treat your symptoms as they occur. So even if you have a low-grade fever, you're going to take Tylenol or Motrin, take something for the cough. There's plenty of things that you can take over the counter to remedy some of your symptoms. Really, you have to just be aware if your symptoms are getting worse. They're unusual. They're above and beyond what you normally have for a cold or your flu. Then that's when you need to speak to your doctor and get that medical attention.
Okay, since we're not all cooped up in the house all the time, we are going out to the pharmacy, we're going to the grocery store. Let's say we run an errand to the grocery store. We come back from there. Should we immediately shower or change clothes? What do you suggest?
Well, here, I would tell you it depends on your exposure. Remember, if you're out in your community, by the time you get in your car, you're touching a lot of different surfaces, especially a lot of surfaces that have not been sanitized. When you get back home, you wash your hands. If you're out where you have that fabric touching other things like your clothes in contact with other things, other people sitting on other surfaces, then yes, you should actually have those precautions and change your clothes, and especially then shower, depending upon what a level of contact that you've had.
Yeah, I guess that none of that would really hurt you. So, all right. Now, you and I have talked off air about this. Gloves and masks for people that I'm assuming don't have any symptoms. Will that prevent you from getting COVID-19?
Well, here's the deal. If the masks and gloves are we're talking a lot about the PPE equipment, the personal protective equipment that's out there, there's a shortage. It's meant for people who are going to be working with those folks who have COVID-19. So if you don't have any symptoms, you don't need to wear a mask or have gloves. Again, I'll say that again. If you don't have symptoms, there's no need for you to walk around with a mask or gloves. Those things are needed really for the people who are taking care of someone with COVID-19. But if you have a cough and you think that you have a cold-like symptoms and you're not sure, then those things, the mask becomes important. And you would first, of course, you're going to stay at home and just protect yourself, protect your family, and don't have a goal of not spreading those germs to everybody else.
We're hearing from Roseville physician Dr. Thomas Hopkins. Tom, we're all anxious for summer to get here, and maybe more so than usual, because we're led to believe, and is there any science behind this, that warmer or hotter weather kills viruses?
Well, there's a lot we don't know about coronavirus, and we're learning about coronavirus. But if you look at the corona type viruses and other viruses, they tend to have a seasonal variation. And generally, that warmer weather and that hotter weather is not something where those viruses flourish. So the good news here is that as we heat up here, that we probably will see some impact on the virus.
All right, here's the next text question. My dad was told me that if you put your hair dryer on high heat and let it blow into your mouth and nose, it will help kill the germs that may cause the coronavirus. Is that true, or are you just going to burn your mouth and nose?
You're just probably going to burn your mouth and nose. I think that there's a lot of misinformation out there in terms of treatments, things that one could do. Really, one of the things that are put in place now with the guidelines, those are things we should pay attention to. If everyone just does their part in paying attention to those guidelines, social distancing, sanitizing, hand washing, not putting your hands close to your mouth and face and whatnot. If you do those things, for most part, that is the mechanism that's going to prevent the spread of COVID-19.